afterwards. First up is Senator Jack Hatch. Jack is leading the healthcare fight here in Iowa and is also working with the White House on the National Reform. Senator?
Thank you, Betty, and I want to thank ICANN for all the work you're doing. The citizens are so important to this fight. And if I can't make that any more clear, today Wellmark just increased 18% of their premiums to 80,000 Iowans who have individual insurance. That is an outrage, and that is something that if we don't change, this system's going to collapse, not for our grandchildren. It will be collapsing for all of us very soon. That's what the National Health Care Plan is all about. That is what we're trying to do in Iowa. And I don't want you to think that things are slowing down in Washington. Yesterday, our group talked with Nancy Andercrawl, who was and is the White House Chief Healthcare Czar, and leading the charge for the President in a phone call with about 90 other state legislators. And without a doubt, the President is focused and committed to a robust healthcare reform proposal. He's trying to get the Republicans in Congress to understand that. And if they don't understand it, the President and the Congress, led by Democratic legislators, are going to have a robust health care before they come home in the summer. In Iowa, we are trying to tackle it even if we are finding it stalled in Washington. We have a proposal, Senate File 2356. That's going to expand Iowa Care to a regional basis throughout the state. So now you don't just go to Iowa City or Broadlands if you're sick and you're poor. You go to your local emergency room in your hospital and have a primary care doctor at a community health center across the state. That is an incredible advance that the commitment of the legislature is going to make, and we will see. And maybe Iowa can have a bipartisan proposal for health care reform and lead the nation again and showing that Republicans and Democrats can work together. But it's not going to be easy. One last thing. We just got our budget targets today. This is not an Iowa problem or a national problem. It is a global problem. We have just been informed that my budget, $1.3 billion last year, will be cut to $950 million. Almost a $400 million cut. That is unacceptable for us. And Iowans at every level, businesses, small businesses, nonprofits, our faith communities, and our individuals, whether or not you're a member of the Teabaggers or you're with the AARP. We have to realize that we are one nation, we are one state, and we have one cause. And that cause is to have a healthier America, a healthier Iowa, and a healthier economy. We can only do that if we do this together. And if we don't have healthcare reform, our economic depression will get worse. So let's start with reforming healthcare and move on from there. Thank you very much.